Hello, and welcome back for another Robin Hood moment. Across New York City, there are 1.5 million people living in poverty, including over 350,000 children. Our mission is to help those New Yorkers permanently escape poverty, and we fund the most impactful organizations and scalable solutions to get there. At the most basic level, this comes down to resources. Today, we'll be diving into the world of benefits access. Research shows that access to benefits is linked to improved health, cognitive, social, and behavioral outcomes. Over 35 years, Robinhood has helped hundreds of thousands of households apply for benefits like housing, food stamps, transportation, direct cash assistance, and so much more. I'm Crystal Cooper, Deputy Director of Communications, and today we're joined by Pam Davis, Senior Program Officer at Robinhood, who spearheads our benefits access portfolio. Pam has been on the front lines of this fight for 20 years here at Robinhood. We're excited to bring you this conversation as part of our series celebrating 35 years since our founding. Pam, welcome.
Hi.
So my first question is a very basic one. Can you help us understand the broad universe of what benefits access entails? You know, when we hear the term public benefits, the average person is probably familiar with programs like SNAP, the Supplemental Nutrition Assistance Program, which helps people, purchase fresh food and groceries. But that just scratches the surface. What is the scope of assistance available to vulnerable New Yorkers?
So when we think about benefits access, we think about buckets of assistance. So you mentioned food nutrition assistance, which is SNAP, formerly known as food stamps, WIC, which is a special supplemental food stamp for pregnant moms and moms with kids under 5. Housing assistance, so rental vouchers, assistance to pay your rent, lower your rent. Health assistance, which is Medicaid, Medicare, access to health care and mental health care. Income assistance, which we think about in terms of tax preparation. Low-income working New Yorkers can get refunds up to $5,000 a year by filing their taxes. The child tax credit, if you have kids in your house under 17. You mentioned transportation assistance, fares, Metro cards, utility assistance, which is for heating and cooling. You may have heard of HEAP and LIHEAP, and also the new broadband assistance where low-income New Yorkers can get money to help purchase a device and access to the internet. Child care assistance, which is vouchers to get your young children into free or low-cost subsidized child care programs. Social Security disability, TANF, which formerly welfare, temporary assistance for needy families, and other cash assistance.
Wow, this is many more types of benefits than I even realize is available to folks. And it sounds like this is, these are very transformative investments. I also, I'm curious if you can help us dispel some myths. There are these cultural tropes that come to mind that I think exist in like the public imagination, that people who access benefits, these benefits are actually preventing them from taking further action to escape poverty. But in reality, public benefits kind of have the opposite effect. That's what we
100%. About 2/3 of people who receive public benefits and entitlements are working. You can work full-time and be eligible for benefits.
Wow, that's amazing. I mean, thinking about a city like New York, so many people are taking advantage of these programs. And, they can actually transform the lifelong trajectory of people living in poverty. One of our core beliefs at Robinhood, as you know, is that where you start out in life should not determine where you end up. And that benefits in this sense is about making one's starting point higher up on that ladder. And I'm thinking really about the lives of children, right? Because they are the ones who are experiencing the starting point. Can you speak a bit on how benefits can transform children's lives specifically?
Of course. If you're a newly pregnant mom and you're on Medicaid or eligible for free or low-cost health insurance, you're also eligible for food stamps. Whether or not you are a documented U.S. citizen, that unborn baby will be. You're eligible for nutrition assistance for that baby. Nutrition assistance, we can follow on down the line. And early on in pregnancy helps ensure that the baby is born at a healthy birth weight. That in itself is an important marker for the trajectory of that child. That 2 or 3-year-old who has access to safe housing, food, regular pediatric checkups, all benefits assistance will likely be kindergarten ready, a kid who's kindergarten ready, likely all the markers that we track in terms of pathways out of poverty. Benefits intersect across all life stage verticals.
So as we mentioned, in New York City, there are 1.5 million people living in poverty, and we're talking about a city of, about 8 million residents. How do we identify and get to the folks who need these interventions? I understand that part of how we get to them is by leveraging our own Robin Hood relationships, because your work cuts across these different portfolios and life stage verticals. You're able to leverage our relationships to meet the folks who need help. What does that look like, and how else do you get to the people who need these interventions?
So 2 or 3 primary prongs. One, we talked about direct services, where we identify and provide funding, resources, and tools and equipment to caseworkers with community partners to screen and help people apply. Stepping back, we need to think about outreach too, and identifying likely eligible participants. So think about a big data set, for instance, the Medicaid list. 10 years ago, 2-point-something million New Yorkers were on Medicaid, and 1-point-something million New Yorkers were on SNAP. We knew that million or so who were receiving Medicaid but not SNAP were likely also highly eligible for SNAP. We partnered with Benefits Data Trust and New York City's Human Resources Administration to do proactive outreach to help identify those people and pull them in and help them apply, because the income requirements are the same, the documentation is the same. So we're expanding that data match work throughout the city with partners.
Wow. So you're partnering with our existing sort of community partners, but also with government to really bring your solutions to scale.
Correct. And I should also say a lot of our direct services are matched dollar for dollar with state and federal grants. To do this work, the required match is a 50-50 public-private match. So we're the 50% private match, and that's probably upwards of $10 million a year that we're able to help draw down into the communities.
I'd like to break your work down further. You've described the full range of benefits available to people living in poverty, but let's also focus on the access piece, right? I know that it's not always easy to sign up for benefits. Some of these folks don't even know all of the benefits that they're eligible for.
So many barriers.
What are those barriers?
So it starts with just awareness and knowing that you're eligible. The next barrier is documentation. Who walks around with their kids' birth certificates and a letter from the landlord documenting income and your recent gas bill and, all that paperwork stuff. The city has created a very user-friendly portal, but you still have to be digitally competent and feel safe and secure uploading documents, attaching it to your case. So many people don't have smartphones. So many people don't have access to high-quality Wi-Fi to upload their documents. So a lot of caseworkers' work is spent helping people get all their documents together. That's barrier one. Then you submit and apply, and you may or may not get it. You may or may not need a mediation, where then you need to call HRA and say, I did submit that. You didn't see that? I'll reattach it. I mean, all the issues of customer service.
Exactly. And don't always get it right the first time.
Exactly. And then once you're enrolled, you have to recertify many benefits annually and reprove your documentation, re-justify your income. And a lot of people fall off at the recert point. We know, and I think this data is pre-pandemic, but about half of the people who are on SNAP today will fall off SNAP and fail to recertify, and then 3 months later recertify, which is
a gap that doesn't need to exist. Right?
Yes, and duplicative cost for the city to help them reattach and for Robin Hood. Right. So we're trying to work through policy angles to reduce churn. A lot of the waivers that city, state, and federal government issued during the pandemic actually staved off poverty. And it's because recertification was unnecessary. They waived.
It was just automatic.
Yeah, there's also, for some, an in-person interview requirement. Some of it is telephonic. Some of it is in person. And if you miss your interview, you get cut off. It used to be fingerprinted under Governor Cuomo, so you had to go to an HRA office, do a fingerprint. They're trying to prevent fraud, which is understandable. And there are other ways to do it, I think.
And that's where you and your team come in.
That's where the partners come in. You know, we give them the funding and the resources and the training and the upskilling, and but they do the hard work. But some of the stories of the blockades and the hoops and that people have to jump through to, you know, have money to buy groceries to feed their children, it's nuts.
Yes. You know, the world of benefits access is largely a world of navigating paperwork and cumbersome online calls, bureaucracy, service reps.
Yep.
Right. But these are real people's lives that we're talking about. Can you describe, you know, if any situations come to mind where our investments have been transformative in the lives of New Yorkers?
The Volunteer Income Tax Assistance Program, VITA, in 2003, Robinhood was the largest private funder, I think, in the country. Flash forward, with our help, New York City's Department of Consumer Worker Protection now funds probably 80 or 90% of the work, and we fund a little bit to keep on seasonal tax preparers. That work is transformative. Somebody who hasn't filed in a year or two,
their annual just income tax.
Correct, because they weren't aware that they had to. The pandemic was confusing, and we heard a story from one of our partners, Center for Family Life, Sunset Park in Brooklyn, an amazing partner. A woman who hadn't filed taxes, I think just in 2 years, and she walked out with a $22,000 refund check, which for her can be transformative. And she, I think, started a 529, a savings account for one of her children who was in the preventative program. I mean, those stories of that much money. But this is a woman who's worked full time. She worked all through the pandemic. And for her, that was transformative.
That's incredible. You know, that's transformative for most any New Yorker, but especially a New Yorker who is either living in poverty or teetering on that line between poverty and hardship. They're actually able to do the things that we all imagine and envision for our children. And it goes back to dispelling the myths, right? That when people receive these benefits and are able to use this money, they do invest it into the future and the health of it.
And she did the right thing. She was working. She was paying her taxes. She just was not aware that if she actually filed, she'd get a check back. So
amazing. So Pam, we pilot so many innovative models like Single Stop that go on to lead the nation in how to smoothen the process of connecting people to benefits. But it's not just other municipalities, right? Here in New York City, is local government also looking to Robinhood or working with us to, implement some of the best practices you've identified?
Yes. When the new mayor was elected, he and his team reached out to us pretty early on as they had this idea. They called it NYC, Benefits Access for All, meaning they wanted to connect eligible New Yorkers to all of the benefits that New Yorkers were eligible for. We joined the selection committee. We joined the task force convening with 40 city agencies sitting around the table. The city has pledged this year, I think it's $14 million, $10 million to community partners to beef up resources, expand access to many of the partners and constituents we care about, exactly, and more. That's terrific and great. The other $4 million is for their back-end system improvement so that their city databases can talk to each other, so that the city can develop technology and data sharing agreements, so that when a sentenced person at Rikers is released, the Department of Corrections and HRA can share data and help proactively make sure that person has food, housing, and his Medicaid is turned on right away. Exactly. So that he can get help and assistance. So we are really excited and hopeful that there will be innovations in the system, reduce redundancies, the need to same documents for the similar benefits.
We apply to the same benefits.
Exactly. And yeah, we're hopeful. We're in year 1, so talk to me in 2 years.
Super exciting. We'll definitely touch base with you, Pam.
Yeah.
And we know that these programs can, hopefully make a dent in that 1.5 million New Yorkers living in poverty figures that, down the line we're not dealing with such an impoverished population. That was Pam Davis, who joined us for a Robin Hood moment. We're so thankful to all the listeners for joining in this conversation. For more stories of impact, interviews, and news, stay in touch with us by visiting us at robinhood.org.